The gluteal region and posterior thigh contain an abundance of large and small muscles, and coursing through these muscles is a vast network of nerves and vessels. These nerves mainly originate from the lumbosacral plexus, whereas the vascular supply derives either directly or indirectly from the internal iliac arteries. Okay, so let's now move on to nerves of the gluteal region and posterior thigh. Most nerves of the lower limb arise from the lumbosacral plexus, a network of nerves derived from the roots of lumbar and sacrospinal nerves that branch out to form the nerves of the lower limb. However, out of all the resulting nerves, the gluteal region and posterior thigh is only supplied by the cluneal nerves, superior and inferior gluteal nerves, the sciatic and pudendal nerves, the posterior cutaneous nerve of the thigh, and nerves to quadratus femoris and obturator internus. Let's start off with the cluneal nerves, which innervates the skin of the gluteal region. The superior cluneal nerves arise from L1 to L3 and supply the skin of the superior buttock. The middle cluneal nerve arises from S1 to S3 and supplies skin over the sacrum and adjacent area of the buttocks. And finally, the inferior cluneal nerve is a branch of the posterior cutaneous nerve of the thigh from S2 to S3 and supplies skin over the inferior half of the buttocks as far as the greater trochanter. Next, there's the superior gluteal nerve, which is formed by the L4, L5, and S1 nerve roots. The nerve courses laterally between the gluteus medius and minimus along the deep branch of the superior gluteal artery, and it exits the pelvis through the greater sciatic foramen above the piriformis muscle. It then goes on to innervate the gluteus medius, the gluteus minimus, and the tensor fasciae latae. This nerve doesn't have any sensory function. The inferior gluteal nerve is formed by L5, S1, and S2 nerve roots, and, much like its brother, it leaves the pelvis through the greater sciatic foramen, but inferior to the piriformis. It's also accompanied by multiple branches of the inferior gluteal artery and vein along its trajectory. The inferior gluteal nerve ultimately divides into several branches, which provide motor innervation to the overlying gluteus maximus, but no sensory supply. Then, there's the sciatic and pudendal nerves, both of which are terminal branches of the sacral plexus. The sciatic nerve is the largest nerve in the body, and it's formed by the roots of L4, L5, S1, S2, and S3 spinal nerves. Interestingly, the sciatic nerve is really two nerves, the tibial nerve and the common fibular nerve, which are loosely bound together in the same connective tissue sheath. Regardless, the roots of the aforementioned spinal nerves converge at the inferior border of the piriformis to form the sciatic nerve, which enters the gluteal region underneath the piriformis and is the most lateral structure through the greater sciatic foramen. When it reaches the apex of the popliteal fossa, the nerve separates into the tibial and common fibular nerves, which are also considered its main branches. Now, the sciatic nerve supplies no structure in the gluteal region, but it does supply the posterior thigh muscles, all leg and foot muscles, and the skin of most of the leg and foot. It also supplies the articular branches to all joints of the lower limb. As a side note, it's important to note that the sciatic nerve can have anatomical variations. As said before, it typically leaves the greater sciatic foramen below the piriformis. However, in up to 12% of individuals, the sciatic nerve divides before exiting the greater sciatic foramen, and its common fibular division pierces the piriformis as it leaves, compared to the tibial division, which still exits below the piriformis. In a very small 0.5% of individuals, the common fibular division will actually leave the greater sciatic foramen above the piriformis, and the tibial division still leaves below the piriformis. Now, medial to the sciatic nerve, there's the pudendal nerve, which originates from the S2 to S4 nerve roots and is the most medial structure to exit the pelvis through the greater sciatic foramen. It descends inferior to the piriformis, posterolateral to the sacrospinous ligament, and enters the perineum through the lesser sciatic foramen. It travels through the pudendal canal, an anatomical structure in the pelvis through which the internal pudendal artery, internal pudendal vein, and pudendal nerve pass. Within the canal, the nerve divides into the inferior rectal nerve at the posterior end of the canal and two terminal branches, the dorsal nerve of penis or clitoris and the perineal nerve. Now, while the pudendal nerve is the main nerve of the perineum, it supplies no structures in the gluteal region or posterior thigh. Next up, the posterior cutaneous nerve of the thigh is formed by the S1, S2, and S3 nerve roots. It lies upon the psoas muscle, from where it travels laterally into the greater sciatic foramen, through which it exits the pelvis below the piriformis muscle. Within the gluteal region, the nerve is initially situated beneath the gluteus maximus muscle. Then it descends superficial to the long head of the biceps femoris in the posterior thigh, where it is deep to the fascia lata. However, it soon pierces the fascia in the popliteal fossa, and it terminates with twigs joining the sural nerve. Now, this nerve gives off three important branches. One of them is the inferior cluneal nerve, as we said earlier. Then there's a cutaneous branch, which supplies the skin of the popliteal fossa. And finally, the third branch is the perineal branch, which supplies the posterior part of the scrotum or labia majora. And finally, the nerves to quadratus femoris and obturator internus are both branches arising from the pelvic surface of the plexus. The nerve to the quadratus femoris is formed by the anterior divisions of L4, L5, and S1, and it leaves the pelvis inferior to the piriformis and deep to the sciatic nerve. It supplies an articular branch to the hip joint and innervates the inferior gemellus and quadratus femoris muscles. On the other hand, the nerve to the obturator internus arises from the anterior divisions of the anterior rami from the L5, S1, and S2, and leaves the greater sciatic foramen inferior to the piriformis to parallel the course of the pudendal nerve. As it passes around the base of the ischial spine, the nerve supplies the superior gemellus, and after entering the perineum via the lesser sciatic foramen, it supplies the obturator internus muscle. Before we move on to blood vessels, let's try and recall the main nerves of the sacral plexus. Okay, switching over to arteries, the gluteal region is supplied or traversed by major branches of the internal iliac artery, namely the superior gluteal artery, inferior gluteal artery, and internal pudendal artery. First, the superior gluteal artery is the largest of the branches, and, from its origin, passes posteriorly between the lumbosacral trunk and the S1 nerve. This artery leaves the pelvis through the greater sciatic foramen, superior to the piriformis, and divides immediately into superficial and deep branches. The superficial branch supplies the gluteus maximus and skin over the proximal attachment of this muscle. The deep branch supplies the gluteus medius, gluteus minimus, and tensor fasciae latae. Ultimately, the superior gluteal artery goes on and anastomoses with the inferior gluteal and medial circumflex femoral arteries. Second, the inferior gluteal artery passes posteriorly through the parietal pelvic fascia between the S1 and S2 nerves. It then leaves the pelvis through the greater sciatic foramen, inferior to the piriformis, only to enter the gluteal region deep to the gluteus maximus and to descend medial to the sciatic nerve. In the gluteal region, the inferior gluteal artery supplies the gluteus maximus, obturator internus, quadratus femoris, and superior parts of the hamstrings. It also anastomoses with its sister, the superior gluteal artery, and it sometimes participates in the cruciate anastomosis of the thigh. This fancy name structure is the union of the inferior gluteal artery, the lateral and medial circumflex femoral arteries, and the first perforating artery of the profunda femoris artery in the upper thigh, which supplies most of the structures of the proximal posterior thigh. And third, the internal pudendal artery lies anterior to the inferior gluteal artery. Its course parallels that of the pudendal nerve, entering the gluteal region through the greater sciatic foramen inferior to the piriformis, which it leaves immediately by crossing the ischial spine only to reach the perineum through the lesser sciatic foramen. Like the pudendal nerve, it supplies the skin, external genitalia, and muscles in the perineal region. It does not supply any structures in the gluteal region of posterior thigh. Moving on, the gluteal region also houses the 4 perforating arteries of the profunda femoris artery. 3 of the arteries originate in the anterior compartment of the thigh, whereas the 4th is actually the terminal branch of the profunda femoris artery itself. Now, the perforating arteries are large vessels with an intercompartmental course. This means that from their anterior origin, they perforate the aponeurotic portion of the distal attachment of the adductor magnus to enter the posterior compartment. Here, they typically give rise to muscular branches to the hamstrings and anastomotic branches that ascend or descend to unite with those arising from the other perforating arteries, or the inferior gluteal and popliteal artery. When it comes to the posterior compartment of the thigh, this part of the thigh has no major artery exclusive to the compartment as it receives blood from multiple sources: inferior gluteal, medial circumflex femoral, perforating branches from the profunda femoris, and popliteal arteries. These arteries form a continuous anastomotic arterial chain that extends from the gluteal to popliteal regions. Moving on, the veins of the gluteal region and posterior thigh are mostly represented by superior and inferior gluteal veins, which are tributaries to the internal iliac veins. These accompany the arteries with the same names through the greater sciatic foramen, superior and inferior to the piriformis respectively, and drain the buttock and upper thigh. Then there's also the internal pudendal veins, which accompany the internal pudendal arteries. The internal pudendal veins ultimately join to form a single vein that enters the internal iliac vein, and they drain the external genitalia, or pudendum. And finally, there are also perforating veins which accompany the arteries of the same name to drain blood from the posterior compartment of the thigh into the profunda femoris vein. The perforating veins, like the arteries, usually communicate inferiorly with the popliteal vein and superiorly with the inferior gluteal vein. When it comes to lymphatic drainage, lymph from the deep tissues of the buttocks follows the gluteal vessels to the superior and inferior gluteal lymph nodes, and from them to the internal, external, and common iliac lymph nodes, and from them to the lateral lumbar or aortic lymph nodes. Lymph from the superficial tissues of the gluteal region passes initially to the superficial inguinal nodes, which also receive lymph from the thigh. From the superficial inguinal nodes, lymph passes via efferent lymph vessels to the external and common iliac nodes. Lymph continues on to the right and left lumbar lymph nodes, draining via lumbar lymphatic trunks to the cisterna chyli and thoracic duct. Now another test. Can you label the 14 structures that come out of the greater sciatic foramen? Here's a hint. One of them is a muscle. Alright, as a quick recap, cutaneous innervation of the gluteal region and posterior thigh is accounted for by the superior cluneal nerves, which arises from the posterior primary rami of the first 3 lumbar nerves, and supplies the skin on the superior 2/3 of the buttock. Next, we have the nerves coming from the sacral plexus, such as the middle cluneal nerve, which originates as a lateral cutaneous branch of the posterior rami of S1 to S3, and it supplies the skin over the sacrum and adjacent area of the buttocks. There's also the inferior cluneal nerve, arising from the posterior cutaneous nerve of the thigh, to supply the skin of the inferior part of the buttocks as far as the greater trochanter. The superior gluteal nerve, formed by the L4, L5, and S1 nerve roots, supplies the gluteus medius, minimus, and the tensor fasciae latae. The inferior gluteal nerve is formed by the L5, S1, and S2 nerve roots, and it provides motor innervation to the overlying gluteus maximus. The sciatic nerve is formed by the roots of L4, L5, S1, S2, and S3 spinal nerves, and it supplies the posterior thigh muscles, all leg and foot muscles, the skin of most of the leg and foot, and it can have anatomical variations. The pudendal nerve originates from the S2 to S4 nerve, and it supplies the perineum. The posterior cutaneous nerve of the thigh, formed by S1, 2, and 3 nerve roots, gives off branches such as the inferior cluneal nerve, which we mentioned, the cutaneous branch, which supplies the skin of the popliteal fossa, and the perineal branch, which supplies the posterior part of the scrotum or labia majora. The nerve to quadratus femoris is formed by the anterior divisions of L4, L5, and S1, and it innervates the inferior gemellus and quadratus femoris muscles. The nerve to the obturator internus arises from L5, S1, and S2, and it supplies the superior gemellus and the obturator internus muscle. The arteries of the gluteal region are all branches of the internal iliac artery, namely the superior gluteal artery, inferior gluteal artery, and internal pudendal artery. The posterior thigh receives blood from multiple sources, including the inferior gluteal, medial circumflex femoral, perforating branches of the profunda femoris, and popliteal artery. The veins of the gluteal region and posterior thigh are mostly represented by superior and inferior gluteal veins, the internal pudendal veins, and by perforating veins. Finally, lymphatic vessels from the deep tissues of the buttocks follow the gluteal vessels to the superior and inferior gluteal lymph nodes, and from them to the internal, external, and common iliac lymph nodes, and from them to the lateral lumbar lymph nodes. Lymph from the superficial tissues of the gluteal region enters the superficial inguinal lymph nodes, which also receive lymph from the thigh.